Before Rashid was born, it was clear the little boy had a serious congenital disease. Rashid suffers from primary immunodeficiency. That is, his immune system is very weak due to a genetic disorder. Only a bone marrow transplant can help him in the long run. The research consortium Primary Immunodeficiency Disorders PID-NET is dedicated to helping children like Rashid. The consortium, which evolved from API, a work group for pediatric immunology, aims to improve research into rare primary immunodeficiency disorders and design possible therapies.
The consortium
comprises representatives from various locations with detailed expertise in specific areas of primary immunodeficiency defects. Freiburg, Ulm, Dresden, Berlin, Munich and Hanover. We work together, liaise, meet regularly, report on our progress and consider how to advance our work going forward.
PID-NET is
as an initiative supported by the Federal Ministry, PID-NET is national for now. But in researching rare diseases, we must never restrict ourselves to national borders. We must always look beyond national borders. PID-NET is very well connected internationally. At Freiburg University Hospital, data from patients all over Germany with primary immunodeficiency disorders are collected and stored in a registry. This registry is embedded in a pan-European, internationally linked registry. The registry makes the work of doctors and researchers considerably easier. An example of success is the case of a colleague from Hanover who wanted to verify an assay in his laboratory. He needed samples of patients with a specific mutation, so he made a request via the registry asking which centers treat such patients. In less than 2 weeks, he received enough patients to verify his assay. It was a nice success story. The registry is a great help. It is essential in cases of congenital disease, particularly in diagnosing the disease as early as possible. That's why it's important to diagnose the children when they're still healthy, at least clinically healthy, as they still have the genetic disposition, so they undergo the intrusive treatment in the best condition possible. It's therefore crucial to establish screening procedures to find these children. Screening programs are already common for congenital metabolic and hormonal diseases. So-called newborn screening is routinely performed in hospitals on the 3rd day of a child's life. The PID-NET program includes a test for primary immunodeficiency disorders, which is said to be integrated into the newborn screening process. Funding procedures have already started. Primary immunodeficiency disorders are definitely target diseases in newborn screening, since they meet all the necessary criteria. We've developed a test by which we can reliably find affected children with a reasonable level of effort. It should also be noted that where newborn screening is already established, the blood samples are in the laboratory anyway. Screening like this does not increase the logistical effort. But the development of appropriate forms of therapy is crucial too. New approaches in the treatment of primary immunodeficiency, for instance in the case of chronic inflammatory bowel disease or Wiskott-Aldrich syndrome in short VAS, have already been developed. The children have a very short life expectancy in the case of a fully developed VAS. The only causal therapy would be a bone marrow transplant. However, this isn't possible for many patients because there's no suitable donor. And we were the first team worldwide to develop a hematopoietic stem cell gene therapy. The research on molecular genetic causes of primary immunodeficiency is a crucial focus of our work, for instance of immunodeficiency disorders which manifest themselves primarily in chronic inflammatory bowel diseases. Especially in the case of serious diseases like these, the focus has to be on the well-being of patients. The self-help group Deutsche Selbsthilfe angeborene Immundefekte also supports the work of the association.
Our heartfelt wish is to pass on our experience so that patients get better and are able to live a relatively normal life.
PID-NET is supported by the Federal Ministry of Education and Research and is currently in its third funding period. But to ensure the association can continue and maintain its important work, long-term funding must also be secured.
Im Augenblick geht es in Deutschland im Gegensatz zu vielen anderen Ländern.
As opposed to other countries, there's currently not as much progress in Germany as we would like. I see a great need to reinforce philanthropic engagement in this respect, telling the people here just how crucial this type of research funding is. Foundations could play a key role here. Incidentally, it is a significant opportunity for citizens to become actively involved and help us help ill children.
Kranken Kindern zu helfen.